Can PHI be disclosed for public health activities? Now, in general, yes. And examples of public health activities include reporting information to a public health authority like disease or injury, reporting vital events such as births or deaths, and conducting any kind of public health surveillance like investigations or interventions. Now, public health authorities include state and local health departments, the Food and Drug Administration, known as the FDA, the Centers for Disease Control and Prevention, known as the CDC, and the Occupational Safety and Health Administration, known as OSHA. Now, a public health authority is an agency or authority of the United States government, a state, a territory, a political subdivision of a state or territory, or an Indian tribe that is responsible for public health matters as part of its official mandate, as well as a person or entity acting under a grant of authority from or under a contract with a public health agency. The privacy rule permits covered entities to disclose protected health information without authorization to public health authorities who are legally authorized to receive such reports for the purpose of preventing or controlling disease, preventing or controlling injury or disability. However, not all PHI can be disclosed to all public health authorities. For example, if a local public health agency only has the authority to collect information regarding births and deaths, a covered entity could not honor a request by that agency for the names and severity of medical conditions of all persons with disabilities. Also, covered entities may, at the direction of a public health authority, disclose protected health information to a foreign government agency that's acting in collaboration with a public health authority. Covered entities who are also a public health authority may use as well as disclose protected health information for these public health purposes. Generally, covered entities are required to reasonably limit the protected health information disclosed for public health purposes to the minimum amount necessary to accomplish the purpose. However, covered entities are not required to make a minimum necessary determination for public health disclosures that are made pursuant to the individual's authorization or for disclosures that are required by other law. For disclosures to a public health authority, covered entities may reasonably rely on a minimum necessary determination made by the public health authority in requesting the protected health information. For routine and recurring public health disclosures, covered entities may develop standard protocols as part of their minimum necessary policies and procedures that address the types and amount of protected health information that may or may not be disclosed for such purposes. Can PHI be disclosed for HIV/AIDS patients? Yes. Covered entities are required to report the names of persons who have a positive HIV test to public health authorities for infectious disease surveillance. In some states, it's also required to report the names of partners of those who test positive for HIV as well. An AIDS or HIV patient's medical information may be shared with the patient's other medical providers to coordinate care and to manage HIV and AIDS as a chronic condition. Federal, state, and organizational privacy policies and regulations need to be strictly followed to allow patient health information to be shared when necessary and appropriate, while maintaining the confidentiality, privacy, and security of this information.